Good morning. Thank you so much for joining us for our second installation of KPHR workshop. Today is going to be about creating an emotionally healthy workplace. We felt that this was a very timely topic. I think that mental health in general before COVID had really started to be a subject that people were starting to talk about, accept a little bit more, really start to focus on not just for their own, personal well-being, but it really started to enter into a lot of conversations around the workplace. And then pandemic hit and boom, now it's at the forefront of a lot of our conversations. So again, that's why we felt like this was a really timely topic. Today we have Kara Bacchia from FirstCall Employee Assistance Program to go through our presentation today. She's also supported by a colleague, Mary Jo Wells. She is going to be here to answer any questions that you guys may have. And with that being said, I think, we still have some people joining, but we're going to go ahead and kick off for today. Kara, do you want to pull up the presentation?
Did you want to go through these two slides, Chrissy, or am I good to start?
Oh, I'm sorry, you're not sharing.
Oh, geez. Okay.
That's okay. I understand it's new technology.
Oh my gosh, it keeps doing that. All right, sorry guys, bear with me here.
And as the presenter, it does present some challenges because you can't always see everything. So perfect. Okay, there you go. We can see your screen. Oh,
so you know what? Hold on, I may have to. Okay, can you still see that?
yes.
Okay, great. So I'll move along, and there you go.
All right, thank you. So those of you on the call that do not know who I am, my name is Chrissy Magnata. I am the Director of Client Engagement here at Katz Pierz. Those of you who do not know who Katz Pierz is, we are a local employee benefits firm based out of Cherry Hill. We focus solely on employee benefits. We're actually celebrating our 35th anniversary this year. And, as we've really worked through just changes in healthcare and health insurance in general, we've started to really evolve in focusing on a lot more of the non-insurance items. So things like supporting HR, supporting employees, whether it's through engagement or education, bringing programs to our clients to be able to support their internal team and their employees. And again, that's why we have kind of forged this partnership over here with FirstCall EAP, who's actually a part of Mainline Health. So they are a local company here. To really start to have a lot of these conversations. Like I was mentioning, mental health in the workplace is it's a challenge. It's a challenge for employees. It's also a challenge for employers in really how they understand how to move through, helping employees without, kind of overstepping bounds or crossing a line or something like that. So today's presentation is really going to be focused around how we can support you in your role in helping support your employees. So just a few housekeeping items. Everybody is on mute. If you do have any questions, please, we encourage to pop those into the chat box. We are going to try to hold off some questions until the end. We're going to let Kara get through her presentation. But of course, as you think of those questions, please put those into the chat, and then we'll try to get to all of those at the end of today's presentation. The other piece that we wanted to talk about is we do have an in-person leave law seminar coming up on May 4th. We're very, very excited to be back in person. So if you are interested in joining us for that, you can go ahead and register. And Grace is going to be popping in a link in the chat box as well. So if you want to copy that link over and register for our seminar. So we're going to be covering leave laws, and then also how leave laws affect your benefit management. I know this says pending, but I did get confirmation last night that we are offering 2 SHRM and HRCI credits for both of those presentations. So again, if you're interested, please sign up for that. And with that being said, I'm going to go ahead and kick it over to Kara to take us through our presentation today.
All right, thanks so much, Chrissy. Good morning, everyone. Thank you for being here today. I apologize again for my technical difficulties earlier. This is a bit of a new platform for me, so I'm still trying to adjust, but I appreciate your patience. So like Chrissy said, my name is Kara Bacchia. I am a licensed clinical social worker, and I work for FirstCall Employee Assistance Program as an EAP clinical consultant. So today, what we're going to be talking about, like Chrissy said, is the importance of having and supporting an emotionally healthy workplace and how we can begin to do that. Our objectives for today are going to be to identify the impact of mental health issues. We'll get an understanding for the benefits of an emotionally healthy workplace. We'll learn how to conduct a program needs assessment. We'll talk a little bit about how to educate your managers, about mental health, but also about the programming that you do have surrounding emotional wellness and mental health. And then lastly, we'll talk a little bit about our employee assistance program, FirstCall, and what we specifically offer for, our customers, the benefits that are geared towards all employees. And then also we'll talk specifically about some of the benefits that we offer, specifically for management. Okay. So I just wanted to take some time to point out that there has really been a significant increase in mental health issues and mental health awareness since the start of the pandemic. You can see some of the stats on this slide here, but in 2020, 49% of American workers sought out mental health care, and 38% of those individuals said that it was in response to the pandemic. 3 times as many adults reported they felt anxiety, and 4 times as many adults said they were feeling some sort of depression. So people now, really more than ever, are talking about the importance of mental health care. There's more talk in the media about mental health education, and there's a lot of encouragement for people to really seek help if they need it and how to access those services. And what we've noticed as an EAP is workplaces are recognizing that as well, and putting an emphasis on promoting emotional well-being at work and promoting mental health care. And employees, are really looking for places of work that support this. So we've noticed this push, and we've really been trying to emphasize, that mental health is on the forefront right now, and it's really a time to work on decreasing that stigma and getting people the help that they need. So there's, absolutely advantages of having a healthy workplace. It just kind of simply sounds like the right thing to do. We obviously want our employees to be happy, healthy, and functioning well at work. But beyond just wanting this for our staff, to be emotionally and mentally well, most employers know that having a mentally healthy workforce is actually going to save you money. It's linked to lower healthcare costs, as well as less absenteeism. A mentally unhealthy workforce is associated with increased loss of productivity. More workers are actually absent from work because of stress and anxiety than because of physical illness or injury. One statistic that I thought was interesting, according to the Surgeon General, 1 in 5 adults will experience a diagnosable mental illness in a given year, and about 15% of those will also experience a co-occurring substance use disorder. So again, this is a really apparent problem, and a lot of people are suffering. There are indirect costs from employees who suffer from mental health issues that increase healthcare costs of an organization. So again, it's really important to be paying attention to the resources that you're providing, the support you're providing for your organization, because having a healthy work environment is so important for the overall success of your company. So it's important to acknowledge, sorry here, I just clicked something. Okay, sorry about that. It's important to acknowledge that treatments for mental health, they are effective. 80% of individuals with depression will fully recover with appropriate diagnosis, treatment, and monitoring. Establishing a healthier workplace is important, and it's going to help to increase the foundation of acceptance for mental health, and help increase the willingness for employees to, get that support, get that help when they need it. So to establish a healthier workplace, you're going to want to evaluate what your current programs are. You're going to want to construct your new programs, create that employee awareness of, not only mental health, but also what your programming is and how you access it. You're going to want to strengthen your programs, and then also educate your managers about mental health and about your programming. So mental health plans really have showed that they have varied in the plans that they offer. So for example, the annual limit on outpatient visits for mental health offered by the retail sector range from 10 visits to 90 visits. So there's really a big difference there. There are tools available to help employers compare plans and decide, which offers the most quality health care to their employees. So you're going to want to use these tools and do your research on, what it is that you're looking for your organization, for your staff, and what you think is actually going to be, quality care for your people. So you want to be asking your vendors specific questions. Some examples of questions to ask would be, do employees have access to mental health information through employee educational and referral programs, the internet, or other self-screening tools? You want to ask, is there a toll-free number that they can access? Are there adequate mental health benefits? Is there a well-trained clinician at the earliest point of contact? Once employees contact your program or your plan, do they receive a diagnosis from a clinician who's adequately trained in areas of mental health? Additionally, you want to ask, how do they handle that referral process to ensure that their employees are matched with an appropriate clinician? Do your participating PCPs routinely screen for mental health disorders? Can your plan integrate services? So these are, some things that are important to ask up front to ensure that you understand your plan and your program, and you know that employees are going to have access to good quality care from trained clinicians. EAP interventions have been shown to improve emotional well-being, as well as produce rapid improvements in work performance. So this will translate into significant reductions in lost productivity, absenteeism, and healthcare costs. So if you don't have an EAP already, you really may want to consider, getting one. Speak to your broker about that, because they have, really good outcomes, and employees, take advantage of those services. So, people who have previous experience with mental health, or they have some education and experience around mental health treatment, they're going to be less impaired at home and at work. They're also going to be more willing to seek help if they have that education surrounding mental illness, and they've been comfortable reaching out for help in the past. They'll be more inclined to do that in the future. So we really want to spend some time surrounding education and awareness on mental health, because really the workplace can be a great place to start to reduce that stigma surrounding mental health. So part of your goal as an organization should be to focus on positive, factual information on mental health care, and also let your offerings, be that starting point for your staff to help break some of those barriers to treatment. To educate your staff on mental health, if you have an EAP, you can use someone from the EAP to offer a training. You can bring in another mental health professional. Examples of trainings could be, about stress awareness. There could be a training on how to spot signs of burnout. Or it could, review different types of self-care practices. But ultimately, this is going to help your staff to become more aware of mental illness and to know what signs and symptoms to look for that could be concerning, and when and how to reach out for help. So if you offer these services, even the better. You can point your employees in the right direction. You can help them get access to that quality care. It's important to include your managers in this process. So they should be aware of mental illness and how to react to employees who might be suffering. Your managers are often going to be the ones able to, point out these concerning behaviors of staff, especially if, those behaviors are impacting someone's work performance. So they can be a great advocate for staff and help them get support when needed, which in turn can really help to increase their ability to function at work. Another aspect to consider when constructing programs is that there's easy access. Again, you want to ask those questions ahead of time and make sure your vendors have easy access to services. Another option is offering mental health screenings. This can be a great way to get people educated, create awareness, and can be an opportunity to make staff aware of what your current plans and programming are. So to strengthen your programs, you're going to want to streamline your vendors to consolidate services for easy access. You want your vendors to work together and be aware of other services offered so that they can cross-refer. You're going to want to utilize your broker to help you get the most for your money. Brokers can help vet programs and give you recommendations of quality services. Brokers tend to be pretty familiar with the different types of plans and programs, and they can help you navigate that process. So, use them, use their expertise to help you pick the best plan for your organization. Again, if you have an EAP, you can use them to link up to other resources in the community. A good example that I have, we have a customer that we've worked with for a number of years, and they reached out to us. They had a situation where they were going to require some mediation for staff who were, they had a team who was in somewhat of a constant conflict, and they thought by maybe bringing in a mediator, a professional mediator, would be helpful. So they reached out to us, and we were able to, get them in touch with some of the professionals that we know that work within the healthcare system, and we were able to give them quality professionals to help them address the issues that they had. So that's one example of how to use your EAP. Other examples would be, EAP can help direct you to professionals who do more specific trainings on, different types of compliance issues, like, maybe workplace harassment or workplace diversity. They can help you get connected to, professional trainers in those areas to come into your organization and facilitate that training. So you'll also want to, as we've talked about before, educate your managers about mental health and also about the programming. So they're familiar of how to access it for themselves, and also so they can support their staff and also point them in the right direction and educate them on how to access services. So beyond that, managers should really be doing regular check-ins with employees. And this should not just be done through email. I think it's really beneficial to have those conversations in person, whether that's virtually, over a video platform or in a one-to-one meeting. But I think it's really beneficial to have that check-in done that way, because you really get a sense for how the person is doing, how they're functioning at work. By doing this regular check-in, the manager is also going to become more familiar with their employee, and they'll become more aware or notice when there are concerning behaviors, when there's changes in behavior, changes in demeanor, or any change in, a work performance. So they'll know, something's up and be able to address that. Managers are oftentimes the frontline observers of their employees. So as a manager, they're going to want to familiarize themselves with some of the concerning signs and symptoms of, of a possible emotional issue or mental health issue. Some of the behaviors that are associated with this, could often mean that there's some type of disturbance in somebody's personal life, or again, maybe they're struggling with mental illness. But some of these concerning signs and symptoms to look out for, you can see listed here on this slide. But oftentimes you'll see an increased conflict among coworkers. Employees will verbalize more frequently about how they're feeling stressed or overwhelmed or feeling pressure. you know, from work or from personal life issues at home. Sometimes you'll notice an increase in miscommunication or misunderstanding. There's often, you know, lack of sleep involved, signs of disengagement from work or disengagement with coworkers, increased use of abusive language, or increased absenteeism. So these would all be considered concerning signs and symptoms. And this, you know, kind of moves us to our next slide about how to create a concern-based plan as a manager. So when you notice a pattern of concerning behaviors, you're going to want to come up with a plan, and the plan should come from a place of concern. So before you have this conversation with the employee, it's always a good idea to, you know, tell your managers that they should first notify HR prior to having this conversation, just so they're in the loop of, you know, what's going on. The manager is going to want to have this conversation privately with the employee to keep it confidential, you know, obviously beyond what they have to tell HR. And, you know, it's important to stress that to the employee as well, that this is a confidential conversation. You want them to be comfortable and feel comfortable opening up. You know, if there are things going on in their personal lives, that can be a hard thing to discuss. So you want to make sure that they know that this is confidential, that HR has been notified, but, you know, beyond that, no other coworkers, colleagues will be informed. And again, this really should come from a place of concern. When a conversation comes from a place of concern, that's going to help to lower the defenses of the person that you're talking to. It's less accusatory, and the other person is going to be more willing to receive, you know, that conversation rather than, you know, completely shut down. So there's no need to offer advice or opinions in this conversation. You want to make sure that you're using non-judgmental language that focuses really on that person's well-being. You also want to try to be as flexible as you can about work-life balance to help support this person in the changes that they need to make, you know, for themselves. And, you know, if there are any work performance issues, you know, it will help address those changes as well. If you have an EAP, during this conversation, it's a good idea to say, you know, hey, we have this free confidential resource. You can call them and speak to a counselor. Again, it's completely confidential, but maybe it's a good idea that you reach out and talk to somebody and get some help and support, and maybe that will help you manage some of your workplace stress as well. If you don't have an EAP, it's perfectly acceptable to encourage them to reach out to a behavioral health care provider. You know, maybe if they've worked with somebody in the past, or encouraging them to contact, you know, your health insurance plan to get them connected with a counselor. So I always like to review self-care, especially for those of us who are leaders. So, you know, all of you, it sounds like all of you are in HR positions attending this training. You know, obviously you have a leadership role. So you want to make sure that you're taking care of yourselves. And then you also want to relay this message to your managers as well, that they're spending some time on reflection, creating self-awareness, and having those stress management strategies in place. So a few things that you can do to take care of yourselves. Spend some time naming your emotions and reflecting on your feelings. It's so important to have awareness of our feelings, our emotions, and knowing when we need to take some time to cope or to practice self-care. When you're faced with a challenging situation, try the best you can to get in the habit of naming one positive situation or one positive thing about the situation. You know, sometimes when we're faced with a challenge, we get really stuck on, you know, the negative, and that can keep us from moving forward to solving the problem. So if we can name a positive, it's going to help us, you know, give us some of that motivation to move forward and address the issue. If you've been finding that you're, you know, feeling overwhelmed at work, or you're feeling, maybe seeing some of those signs of burnout, you want to remind yourself, you know, why it is you do what you do. What are those aspects of your job that you do enjoy? You know, what are the things that you take pride in? and remind yourself of those things to give you, again, some of that motivation to continue in your work. It's always important to have awareness of how you're treating other people. You want to make sure that you're giving positive feedback, when it's due, pointing out to people when they've done a good job, giving that encouragement, when you care, show it. As best you can, try not to take others' feedback personally. Remember that that doesn't define you. Remember to take breaks. You need to take those breaks to take care of yourself. Find a purposeful activity that's meaningful for you to help you manage your stress. So, that might be going for a walk or reading, watching, a TV show, taking some time to reconnect with friends or family. Whatever it is, it should be an activity that helps you to recharge and feel rested. The other thing I like to mention is, it's important to take breaks throughout the workday as well. And I know a lot of people, often feel like there's no time for that. They're often going from meeting to meeting, and it feels like the day is just this never-ending cycle of, your to-do list. But as much as we can, we really want to try to take a few short breaks throughout the day, whether it's 3 minutes, 5 minutes, to just take some time to, look away from your computer screen, put down the phone, go for a quick walk, or maybe even just sitting with yourself and taking a few deep breaths, shutting your eyes and taking a moment to just breathe and take a break. And then, obviously outside of work hours, you can do some of those self-care activities and dedicate a little bit more time to them. But again, breaks are really important and give us that energy that we need to move throughout our day. You want to sharpen your awareness of your daily developments. So identifying our strengths really helps us to manage our stress. A lot of times we get into the habit of pointing out what we didn't get to during our workday or what we've done wrong. And we really want to work to refocus that. We want to focus on all of the accomplishments we were able to get to. We want to identify our strengths, those things that we're good at. When we do this, we're helping ourselves to be more resilient. We're giving ourselves more motivation to move forward and manage stress. So this is a big part of stress management and self-care, is to be able to identify our strengths and those things that we're good at. Okay, so I'd just like to spend some time reviewing our services as an EAP here at FirstCall, some of our employee benefits. You can see here listed on this slide, but we have a call center that's available 24/7. It's toll-free and a completely confidential line. We really stress that this number, again, is available 24/7. We work with a lot of different healthcare organizations, and sometimes we have clients who are nurses or doctors, and they can't always give us a call during regular work hours. They need to call early in the morning or late at night, and they're able to do that and speak to a live person who's a master's level counselor, who can also offer in the moment support. So that's another thing that we like to highlight, is that you can get support from that immediate phone call to our EAP. A lot of people sometimes have just a difficult day. They're working with a difficult patient, or there's been a poor outcome at work, and they just need to do some quick processing with a trained professional. So they can call the 800 number and ask for that in the moment support, and they'll get that from a master's level counselor. Beyond that, we offer free and confidential short-term counseling sessions with a licensed clinician. We offer different session models depending on what the organization is comfortable with, but we have a 3-session model, a 5-session model, and an 8-session model. Those are our most common ones. And then beyond that, we do a lot of work with referring our clients to long-term providers, for that long-term care if they need it, to a therapist who's covered under their insurance, who's close to their home. The other thing I want to mention is, most of our counseling right now is being facilitated virtually. So clients have the option of a phone call, a session over the phone, or a video session. And we've received a lot of positive feedback about, counseling through telehealth. A lot of people find it so much more convenient to be able to have a session over the phone or hop on a video call rather than, driving to an appointment. Sometimes they can't get away from work, or, they have kids and it's hard to fit another appointment into their, daily schedule. So we've had a lot of positive feedback about offering telehealth. So in addition to that, we also offer free 30-minute legal and financial consultations. So all employees are eligible for this benefit, and consultations are authorized per legal and financial issue. So, we get a lot of calls from people looking to do some sort of will preparation. So that would be covered under their legal benefit. And then say, a few months later, they had another legal issue come up separate from will prep, they can call and get support for that because they're two separate issues. We also offer discounted hourly rates for both legal and financial services if they're needed beyond that initial 30-minute consultation. We offer work-life consultations and online resources as well. Work-life services are related to those daily living needs. So think, child care support, elder care support, relocation, pet care. We get many calls from people looking for, information on daycares in their area or summer camps for their kids. People looking for elder care facilities for their aging parent. They call our 800 number and we can get them connected to a consultant who can do some of that research for them and let them know of the best programs in the area. We also offer monthly wellness webinars. These are on various topics related to mental health and wellness. I believe this month our online webinar is related to how hobbies can be beneficial in stress management. And I believe next month our webinar is related to having good sleep hygiene. So the topics are very relatable. And again, they're available online. And once they're made available, they're actually archived on our website for up to 5 years. So our customers, our employees have access to really 5 years worth of mental health and wellness webinars on our website. So in addition to those overall employee benefits, and I should mention too, those benefits are eligible for household members as well. So, if a client's spouse or, roommate needs to call in to access counseling services, they're absolutely able to do that and they can access the benefit. But beyond that, we also offer support and services specific to our customers' management. So we have management consultations with EAP clinical consultants, and basically managers have unlimited access to this. They can call our 800 number and ask to speak with a consultant regarding some sort of management issue. So whether that's, they're struggling with an employee who's displaying performance issues, or they have, somebody who has broken some sort of company policy and they need some advice on how to address that. They can call us and get a consultation, and then we can kind of support and direct them in how to handle that process. We also offer formal and mandated referrals to the EAP. So this is when an employee might be displaying serious performance issues, or they've violated some sort of company policy and they need to be referred to the EAP to essentially ensure that there's not some, mental health or substance use issue that may be driving these performance issues. So we can do an assessment and then offer, support for that employee. Sometimes, it's required for us to do an assessment and we may need to refer out to some sort of day program or inpatient facility. And when we do that, we act as the case manager or the liaison between the treatment facility and HR. So HR knows that their employee is getting adequate care, treatment, and that they're progressing so that, they can come back to work and be in compliance with whatever recommendations are. We also offer wellness trainings specifically for managers or all staff. We frequently offer trainings related to stress management, how to take care of yourselves as leaders. We'll offer different things about, recognizing burnout and how to address it, things like that. Critical incident stress debriefings are another part of our EAP package. And basically what that is anytime an organization, experiences some sort of workplace trauma, violence, or maybe some sort of significant stressor, a manager will contact us and let us know, what is going on. And then we'll kind of customize, the type of support that they might need and offer that. But typically a critical incident stress debriefing involves one of the clinical consultants coming in and doing almost like a group session with the staff involved, to help them, kind of normalize the feelings that they're experiencing from this event, educate them on some of the signs and symptoms of stress reactions, so they kind of know what to look out for. We'll talk about coping strategies for how to deal with that stress, and then let them know, we're here, we're the EAP, we can offer support if needed. And then we have plenty of online resources as well, geared towards management, but also towards, also for all employees. Okay, so that concludes our presentation. Can I answer any questions about our topic today or about FirstCall EAP?
So as a reminder, everybody can just pop your questions into the chat box. So the first question I have here is really going back to those conversations you're having with employees. I think it's more directed to the manager conversation, but again, generally speaking, if you could give a little insight around maybe some best practices. But the specific question is, are conversations confidential except if they mention abuse, self-harm, or harming others? And are employers considered mandated reporters?
That's a great question. So the first part of that question, yes, safety always trumps confidentiality. If somebody, an employee, or, you're made aware of an employee who has been self-harming or has been, talking about, wanting to harm other people, those are major safety concerns. And again, it should be addressed with the employee. HR should be brought into the loop. And then, if there is a emergency contact on file, that conversation should be had with the employee about, okay, how can we, let's notify this emergency contact. We want to make them aware of what's going on. If you have an EAP, you absolutely want to loop them into the conversation as well. They can do a clinical assessment with the employee, to determine the safety risk and get them to the appropriate level of care if needed. But if you're having that conversation with the employee, again, you can approach it from a concern base, and say, listen, you're expressing a lot of concerning statements, and I have to take those seriously because we care about you and we want to make sure that you're safe. So here's what we need to do. Now, the second part of that question, are employers mandated reporters? That I am not sure. We can look into that. I would have to guess it may depend on your place of work. Some places are more, places of work are more geared towards like social services or healthcare. I think, don't quote me on this, they're more likely to be mandated reporters than maybe some other organizations, but that's something that we can look into and get back to you on.
Great. Are there any other best practices that you can recommend when having these conversations? Obviously, they're very sensitive conversations. Sometimes broaching an employee that may be struggling, it's tough to start that conversation. But the other piece of that is, as employers, and just thinking about it from a compliance and liability standpoint, some employers just may feel a little uncomfortable broaching that subject because it could possibly put them in a position that they need to consider. So any best practices you can guide us on?
Sure, yeah, and it's important to remember too, as the employer and as the manager, you're not the counselor. So you're not going to exactly know all of the right things to say. You're not going to be required to be this person's counselor. But what you can do is point them in the right direction. So you have this concern-based conversation, and you talk about resources available for them. Again, I hate to keep, I don't hate to, but I know I keep emphasizing EAP here, but really, you know, contact your EAP. See if you can speak to the EAP clinical consultant first, because they do have that trained background. They will always have a clinical license and know, okay, this is how you can appropriately address this conversation. And also, you know, if they feel like this person really does need to speak to a counselor, they can formally refer their employee to the EAP, so they know they are having a conversation with the counselor and they don't have to take responsibility of that. But what they're doing is opening that door, opening that pathway for their employee to get the help that they need. So don't feel like you need to know all of the best practices or all of the right things to do, because, you know, that's not your background. But that's why companies do have the EAPs in place, so they can rely on that support to get that, you know, clinical expertise.
Great.
Any other questions?
It does not look like we have any other questions coming through at this time.
Okay.
I will say that we will be sending out a follow-up email. So we'll be including the contact information for both Kara and Mary Jo. So if anybody does have any questions that they want to specifically float by them, or if they're interested in looking into putting in an EAP, they can certainly speak with Mary Jo and Kara about that as well. So we will be sending out an email with some follow-up information from today's presentation. Kara, I think this was great. Like I said, very timely topic. I think there was some great information shared today, and a lot of takeaways that we can certainly start to implement in our own day-to-day operations. So thank you for your presentation.
Yeah, of course. Thank you for having me. And again, I thank everybody for being here, and I hope everybody enjoys the rest of their day. Okay.
Thank you, Kara. Thank you, everyone. Have a good day.
Bye.
Hey, nice job, Kara and Chrissy.
I don't know how to log out of this.
I'm going to end the webinar for everybody.
Okay,
Thank you, Mary Jo.
Okay, you're welcome.
Thank you all. Have a good one.
Guys.
Bye.